Contractions get top billing when people talk about labor, but today I want to talk about some of the sneakier or weird parts of labor that you might not know that you can be watching for as one of the signs of labor. As a reminder, labor usually doesn't come by itself. Contractions will come here and there, but real labor usually brings some of these friends. So I want to talk about these weird things because people don't talk about them. Some of them are a little bit uncomfortable. And honestly, one of them I think people forget, but because I've seen people for 20 years in labor and delivery, plus talked to millions of patients online and had 3 babies of my own, I really know some of these weird things that you might expect before it's time for baby to be born. While you're watching this video, if you've had any of these weird signs, tell us down in the comments. I think it would be a fun conversation to have. The first one, which literally makes no sense, is that you can breathe better. Now, your uterus has been just like slowly inching up into your diaphragm. Obviously, it's your baby that's helping it, sneak up there. Your uterus doesn't do it on its own, but it's been taking up a lot of your lung space, which is super, super rude. But at some point in time, this baby is going to drop into the birth canal, and suddenly you're going to realize that you can take a bigger breath. Now, your bladder is going to start waving a white flag at that point in time. And I will say that this doesn't happen for everybody. I actually have a whole video on if your baby has dropped. I'm going to link it down below. But sometimes people notice when they're in labor that suddenly they're able to take like a big deep breath in and they're like, what just happened? And that can be a sign that baby's dropped and maybe things are progressing into the birth canal. It's not just that you got superhuman lungs, although you are superhuman because you are growing another human inside of you. Strong work. And as a side note, some people call this fetal lightening. If you've ever heard of that, it's just when baby drops down into the birth canal. And a lot of these terms were started by midwives like way long ago. And it can feel a little zappy, but it's different than symphysis pubis pain, which can also feel real zappy. Pregnancy's magical. The next one, and so much fun, is changes in discharge. As your uterus is getting the cervix to chill out, open up, it's releasing hormones and the cervix may be releasing things into the birth canal that then come out, which is why a lot of people end up wearing a pad during those last couple of weeks of pregnancy because things can be a little bit more watery, changes in color, if it's itchy or things like that. Or if you have any concerns at all, always talk with your provider, but changes in discharge can be a fun sign that labor might be coming. Ugh. Why is it so gross? I don't know. When you're talking to your provider about this, blood can be a normal sign of labor, but talk with them to find out what's okay for you or how you should get help if you're noticing a little bit of bleeding. If you're noticing a lot of bleeding, you need to head into labor and delivery. And if you're thinking, Hillary, I love tips like this, I actually have one of my full bonus printables in the online prenatal class for couples, goes through these important things to watch for as you get towards the end of pregnancy and get help for. I'm going to link that class down below. The next one is nausea or diarrhea. So fun fact, your birth canal comes this way, but right behind it is the end of your GI tract, so your rectum and your anus. And if that area is all filled with what is in that area normally, it makes it harder for baby to descend. Not to mention your body knows you're going to be putting a ton of energy into this uterus contracting and all the things that surround labor. So it's thinking, the more I can digest and get things out of the way, the better this is going to be for us. But that's why sometimes your body will clear out your gastrointestinal system in preparation for labor. Now, it can also just do it because you had some bad Chinese food, or your GI tract is just a little bit more prone to that during pregnancy sometimes too. So it's not always a direct sign of labor. But again, I'm telling you that labor usually comes with a few of these different signs. Too bad you don't get to pick which one it is, right? Another one that a lot of people report is feeling very sleepy. Suddenly they immediately just need a nap. Now, this is going to be real hard in those last few weeks of pregnancy because you feel very sleepy a lot of the time. So how do you differentiate it? I don't know. You probably only know this going back, but sometimes just feeling like overwhelmingly tired can be a sign of labor. Of course, conversely, having a burst of energy can also be a sign of labor. It would make sense for Mother Nature to give you that burst of energy to get your house ready. There are things that you would have had to prepare when you were a caveman. I don't know what they were, but in order to have the baby. So it does make sense that you would get a burst of energy. Some people report it, some people don't. But it can be one of those weird signs that people say they had before they went into into labor. And if you're like, Hillary, really? So either I'm going to be super tired or I'm going to get a burst of energy. That's just how labor and delivery is. It can be really confusing, which is why I recommend a birth class that goes over early labor signs, when to go to the hospital, how to manage early labor at home. Again, the birth class that I recommend, I'm going to link it down below. Now, if you're just like, Hillary, I want to know when, I actually have a whole labor predictor quiz that I'm going to link to up above and down below. It's going to go through some of these different things with you and try and help you decide if you're going into labor or not so much. You guys might find it helpful. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.